Hi, I'm Deirdre Mooney, one of the fellows in training here with our Fits on the Go blog. We're here on Sunday at the ACC 2015, and I'm delighted to introduce Dr. Pepine.
Well, hello. I'm delighted also, Deirdre, to have this opportunity to deliver a message. And as we were talking just a few minutes ago, one topic that concerns me greatly here is the trend that I'm seeing among trainees and fellows in particular, and also junior colleagues, to abandon or ignore their internal medicine and general medicine roots. Basically, what I'm referring to is not paying attention to diseases that have major impacts on the vasculature or the heart. For example, diabetes. For example, dyslipidemia. Thyroid disease is a major culprit. I'm seeing our trainees just close their eyes to high hemoglobin A1Cs, very high TSHs, and just say that's taken care of by the primary care physician. And my response to that is it's not taken care of very well. It's clearly contributing or maybe caused the vascular disease that we're asked to take care of. And I think that we need to step in and to do some things to try to change that. We need to provide the care that we were trained to provide when we were in our internal medicine training. And maybe the primary care physicians who were responsible for caring for these things will get the message. Maybe they'll end up taking better care of the patients. But I also think it's our obligation to give the patient the best care that we can, whether or not they're in our subspecialty clinic, or even worse yet, one of our subspecialty clinics.
I thank you for recognizing an opportunity for us in our level of training. It sounds like there might be multiple reasons. It could be insecurity. Maybe fellows in training feel that they don't have a mastery of that knowledge, or fear that they're over encroaching their boundaries. I know one of the challenges when you start going from resident to fellow is how to become that excellent consultant where you manage what needs to be managed for providers who've asked for help and want you to do more, but you also just provide advice and let others choose. Do you think it's from insecurity? Is it from time balance? Is it lack of interest?
Deidre, I don't know exactly where it comes from. And I try to reflect back on my own career and when I left my internal medicine training. I don't really think I developed the attitude that I was going to ignore particularly some of the disorders that we're talking about that directly impact the cardiovascular system. So I can't tell you where it comes from. Actually, before you sat down, I was discussing this with a colleague. His response was interesting. He says, well, we can't bill for it unless we want to change our codes to some internal medicine codes, which destroys the whole structure for billing. So maybe that's some of it. Maybe some of it has to do with our healthcare systems. Another gentleman who was sitting on my other side said that in some of the larger practices now, and we see this in Florida too, they've actually started to hire internists and family practitioners to work in the office of large cardiovascular groups. I think maybe that's the answer to it. It gives you immediate access to a more general care plan, patients like that. I know our patients would rather come to us to talk about these problems than to go to their PCP, which always struck me as difficult. But maybe that's the way to approach it, is to incorporate generalists into practice rather than trying to force specialty trained people back into a more general care pattern.
But I think you've highlighted that this is very relevant to cardiovascular health. I can't think of almost any disease that doesn't impact the cardiovascular system. And many people think that their cardiologists are their internists. I mean, it's an important relationship that we develop with these patients. And it might be that if we discuss these, it might have a greater impact on their care. So I really appreciate you highlighting this. Dr. Pepine, this was interesting, provocative, and delightful. Thank you for challenging us.